with the support of an educational grant from Provision's Pet Specialty Enterprises, a division of Ralston Purina Company. The American Animal Hospital Association recognizes Purina's dedication to meeting the nutritional needs of pets and appreciates Purina's support of the veterinary profession. Chances are at some point in time, if you're part of the veterinary healthcare staff, you'll be handling an animal. It might be when the animal first arrives with its owner, or you may be removing the animal from a cage or carrier, or restraining the animal for an exam or injection. Although there's no one restraint technique that applies to every animal in every situation, there are a couple of key factors to keep in mind that will help you handle any type of dog, cat, bird, or small mammal. Not only will this tape demonstrate safe and effective handling techniques of animals in the clinic or hospital, but also the importance of proper handling, how to handle normal, frightened, or aggressive animals, as well as proper restraint for exams, medication, or other medical procedures. It'll also provide a special section on handling puppies and kittens and provide training in observation skills should the patient's condition change, and you should need to notify the veterinarian. Many of the techniques demonstrated in this tape are intended for aggressive animals. However, in the interest of safety, non-aggressive animals were used to demonstrate these techniques. As part of the veterinary health care staff, you must be able to portray yourself to clients as a knowledgeable and intricate part of the pet care team, and you must do this with confidence. In order to accomplish this, you'll want to look at the animal's medical record for behavior information before the animal arrives. If this information isn't available, observe the pet's body language and behavior, as well as the owner's behavior with the pet. Be attuned to any comments the owner may make, such as, "He doesn't like strangers," "He's nervous," "He always knows when he's at the veterinarian." Make a note of the pet's behavior, as well as any telltale comments from the owner, and record it in the appropriate place in the patient's medical record for the handler and veterinarian. It's also helpful to know about the species' normal behavior. This is crucial because abnormalities or changes in normal behavior are often indicators of disease. General examples of this might be aggression, changes in activity level, or changes in eating, drinking, or elimination, to name a few. Animals have a unique means of communication. When animals do communicate with us, and members of their own species, it's often through a combination of body position, facial expressions, actions, and verbal communication. With a basic understanding of animal behavior, knowledge of the procedure being performed, and behavioral information about the animal, you should be able to choose the appropriate restraint technique. Most importantly, the restraint technique you do choose should be humane, as well as control the animal's primary means of defense. At the same time, the technique should be safe, calming, and secure for the pet, as well as visually acceptable to the owner. Sometimes the safety of the owner, yourself, or the pet cannot be assured with conventional restraint techniques, and you may need to use other methods that the owner may not find appealing and the pet may find unsettling. If this is the case, you may want to consider using a type of restraint collar, muzzle, blanket, or in very extreme cases, a snare, or maybe a tranquilizer. A dog's primary means of defense is biting, so restraint and handling techniques must control the dog's mouth. In most cases, when a dog arrives at the clinic, you can lead them with a leash. The leash shouldn't be able to slip off the dog, so be sure it tightens around the dog's neck or is clipped to a secure halter. It may be better to carry small dogs, especially if they're not aggressive and they are used to being carried. Most cats can also be carried, but you'll probably want to use a cat carrier since cats defend themselves with their claws and teeth. It's a good idea not to handle wild animals such as bats, skunks, raccoons, or even stray domestic animals with your bare hands. It's best to pick up these animals with a towel, blanket, or gloves and place them in a holding or transport cage. Most birds and small mammals are brought to the clinic in a cage. Until it is time to treat these animals, it's a good idea to leave them in their own cage or carrier. Now that we've gotten a glimpse at how to handle animals during the initial contact, let's take an in-depth look at how to handle each type of animal. Although there are a lot of different behavior types a handler may encounter with dogs, generally there are 3 types of behavior in dogs. There's the dominant aggressive dog, the fearful aggressive dog, which may be a combination of dominance or fear, and the non-aggressive dog, which includes fearful and friendly dogs. The dominant dog can be recognized by its body language. The ears may be forward, with eyes wide and staring, and the tail may be standing up. They may even be growling and bare teeth. A fearful dog may crouch down and lower its tail, and the ears may be back with dilated pupils. It may or may not become aggressive. The fearful aggressive dog may curl its lips, bare its teeth, and growl, while the non-aggressive fearful dog may crouch, withdraw, or expose its stomach. Once you determine the dog's behavior, you'll want to approach it in an appropriate manner. Leashes are probably the best way to lead a dog out of a kennel or cage, regardless of how friendly the dog seems. It's usually best to take a dog from a kennel or cage with a leash around its neck or attached to a halter. Not only does this prevent the dog from breaking free, but it also controls the head should the dog suddenly resist or become aggressive. Encourage the dog to approach the front of the cage or carrier with verbal reassurance, and if you need to, gently pull on the leash. Dogs in bottom cages or runs can be led directly out. If the dog is in an upper cage, grasp the head under the neck with one arm and the body with the other, so the dog can be lifted from the cage. In some cases, it may be inappropriate to remove a dog from the cage with a leash. The dog might be small, nervous, and non-aggressive, and can be coaxed slowly out of the cage, allowing it to approach on its own. Or the dog may be aggressive and requires special handling. Or a patient may be hospitalized and cannot stand or walk properly. A leash around the neck may only cause problems rather than help. When taking hospitalized patients out of the cage, take special care with injured parts, such as casts, splints, bandages, and other sensitive areas. To place a small dog on an exam table, crouch down on one side of the dog, whether it's standing or sitting on the floor, and cradle your arm under the neck and restrain the head snugly to your body. If the dog has a painful back or stomach, place your other arm behind the rear legs instead of under the stomach. Once the dog is on the table, maintain the neck hold and use your other arm to hold the dog on the table or to keep the dog standing. Be sure to talk firmly and positively to the dog at all times, and if it is struggling, hold it firmly in place until it stops struggling. If the veterinarian thinks the dog might become aggressive, apply a muzzle before the dog gets too nervous, frightened, or defensive. It might be safer and quicker to have the owner apply a commercial nylon or leather muzzle that slips over the nose and snaps up behind the neck. You can also use a piece of gauze or a ribbon as a muzzle. Just make a loop and slip it over the nose and tie it behind the neck. Since the dog must pant to avoid overheating, these types of muzzles shouldn't be left on for more than a few minutes. Wire or plastic basket muzzles aren't as easy to place, but they can be left on for an extended amount of time because they do allow dogs to pant. You can also use a promise halter, which allows you to control the dog's muzzle and nose. Although it doesn't act as a muzzle, it'll give you sufficient control, and it'll let the dog eat, drink, or pant. Once you've muzzled an aggressive dog, place it on the exam table and restrain it in sternal or lateral recumbency. A large dog may be too heavy for one person to lift. If you need to lift the dog, one handler can secure the head while the other supports the stomach and lifts the hind end. Some dogs can be restrained by holding them with both hands on the back of the neck and, if you need to, pushing them onto the table into sternal recumbency or flat on their stomach. There are many methods of removing aggressive dogs from their cage. It just depends on the size of the dog, how aggressive the dog is, and devices you can use to help the situation. Sometimes aggressive dogs will need a chemical restraint in order to perform certain procedures or to reduce the dog's fear and anxiety. You can use a number of techniques to maneuver the dog into position for a tranquilizing injection. Sometimes, when a dog is still on a leash in the kennel, but you cannot safely muzzle it, you may need to pull the dog's neck snug against the door of a cage or run by pulling the leash through the bars. Once the head is safely restrained, you can give the injection. In extreme situations, you may need to use a snare. The dog can often be held in position so that you can give an injection safely and easily. For dogs in upper cages, you can use a leash to hold the dog's head taut, while the other hand reaches under the dog's stomach to lift it onto the table. Some small dogs can be removed from the cage and restrained with a blanket, or you can carefully slip a leash over the dog's head in order to lead it out of the cage. As part of the veterinary health care team, you may need to restrain a dog while giving it an intravenous injection. If the dog is going to receive a cephalic venipuncture, the dog should be in the standard restraint position. One arm is used to restrain the head and neck, while the other arm restrains the elbow of the foreleg, just proximal to or above the elbow. It may be easier to restrain some large dogs by sitting them on the floor and holding their head as we've just demonstrated. Kneel beside the dog and with your other hand reach over the dog's shoulder and grasp the other foreleg just proximal to the elbow. You can use a muzzle if the dog is too aggressive, or get another assistant to help you by restraining the hind legs if the dog begins to struggle. You may need to use a sedative if the dog is too aggressive for a muzzle. A pre-anesthetic sedative is extremely useful for fearful or aggressive pets. For jugular venipunctures in larger dogs, you can restrain them by sitting them on the floor or sternally on the treatment table. Use one hand to hold the muzzle and extend the neck, while the other hand restrains the body in place. For small and medium-sized dogs, hold the dog under your arm while your hand reaches under the chest. Now grasp the forelegs. The muzzle and chin can be extended up and back with your other hand. A jugular venipuncture can then be performed with the dog held in your arms or with the dog sitting on the table. For cystocentesis, it may be possible for a single handler to restrain the forelegs in one hand and the hind legs in the other while the dog lies on its back. If the dog is uncooperative, a second handler may be required for the back legs, while the first handler holds the forelegs and head. Cats may show a variety of different reactions once they arrive at the clinic. Generally, there are two types of behavior you'll see in cats: aggressive due to fear, and non-aggressive cats that may be fearful or friendly. A lot of times, fearful cats will have dilated pupils, an arched back, flattened ears, and their hair may be standing up on the scruff of the neck, and they may even be panting. A defensive or aggressive cat may have their ears and whiskers back, tail arched, and teeth exposed. When frightened, some cats will try to fight or lunge at you. Some will try to escape, or some will freeze with fear. But unless cornered or excessively restrained, most cats won't fight back. In any case, if you grasp the cat at the back of the neck, you free their front legs to grip the table, making them too occupied to scratch. If a cat is in a front opening carrier, grasp it gently behind the neck and pull it forward slowly, or gently tip the carrier. If the cat is in a top opening carrier, grasp the cat gently behind the neck and lift it up and out of the carrier. If the cat is tentative, it might be best to take a large blanket or towel and drape it over the cat. Once the cat is lifted, you'll want to carry it in the proper carrying position. This means you'll need to restrain the forelegs as well as control the head and rear legs. You'll need to carry the cat under your arm while that same hand is placed between both forelegs and your middle finger between the two forelegs. The cat's body should be snugly restrained against the side of your body with your forearm and elbow controlling the hind legs. This allows your other hand to control the cat's head or neck or open a cage door. Keep in mind, if the cat doesn't struggle or act aggressively, it should be held as gently as possible. This prevents fear and escape. At the same time, be aware of the cat's teeth or rear claws in case it does try to escape or becomes frightened. For exams or treatments, the restraint technique you use depends on the cat's response to fear, handling, and pain. In general, minimal restraint leads to minimal resistance, but you should always be prepared for the cat to escape, resist, or turn aggressive. Depending on the procedure, many cats can be examined with no restraint other than a hand gently but firmly placed on the back of the cat's neck, pressing down toward the table to prevent escape. It might be helpful to let the cat's front paws curl around or grasp the edge of the table. If the cat begins to struggle or tries to escape, use your other hand to restrain the back of the cat's body firmly onto the table in sternal recumbency, or you can use your other hand to grasp the hind legs with your middle finger between the two legs while the cat's hindquarters are lying on its side. Distracting the cat is also helpful, especially if an injection is needed and the cat is struggling, or if an uncomfortable or sensitive area must be examined. You can distract the cat by making sharp, quiet noises, blowing on its ears, or scratching the cat between the ears. You may also want to gently shake the back of the neck or tap their nose or top of the head. In order to safely restrain a difficult or aggressive cat, you may need to firmly press the head and neck to the table with one hand, while the other hand presses the cat's shoulders. The other person then presses the hind end to the table. The cat must remain in sternal recumbency so it doesn't escape or cause injury. For cystocentesis, or procedures requiring the exposure of the abdomen, the cat can be placed on its side or back with one hand grasping either the scruff of the neck or the forelegs, and the other grasping the hind legs. For jugular venipunctures, the handler can hold the cat's forelegs with one hand, and the other hand can be used to extend the head and neck. To perform a cephalic venipuncture, the cat should be held in sternal recumbency, holding the head with one hand and the forelegs and body with the other, while the leg is held for the injection. Femoral venipunctures require the cat to be restrained in lateral recumbency with the head restrained to the table along with the front legs. The other hand restrains the hind legs and at the same time holds off the femoral vein. You may need to enlist a handling aid if a cat is too troublesome and conventional methods aren't working. But first, you may want to try throwing a large blanket or towel over the cat, grasping it behind the back of its neck, and lifting it from its cage. Once the cat is on the table, you may pin the cat sternally with the towel, or wrap the towel around the cat's entire body, leaving just the head free for examination, medication, or even a jugular venipuncture. If the cat is going to receive an intramuscular injection, you can expose one of the rear legs. You may need to place the cat in a cat bag or use a fishing net to remove the cat from a cage. Cat muzzles are also helpful, either alone or in combination with other techniques. Muzzles calm cats and protect you from being bitten. Chemical restraint is also useful for treatment, testing, and sometimes for an examination of an aggressive cat. Of course, these sedatives may also be necessary and helpful prior to intravenous anesthesia of an aggressive cat. Plastic shields or restraint cages are also helpful in giving the cat an injection. If you need to administer mask or intravenous anesthesia, you can wrap the cat in a towel or a cat bag. Handling and restraining birds is a more delicate process. When you remove a bird from its cage, be sure the area surrounding the cage is enclosed to avoid the bird's escape. But before you remove the bird from the cage, first remove mirrors, food, perches, and other dangling items so the bird doesn't injure itself if it tries to escape. It's also helpful to place a towel over your hand when first placing it in the cage because the bird won't be able to identify where your hand is. The most important thing to remember with birds is to restrain the beak, since they often try to bite. But if you're restraining a bird of prey, The talons are more dangerous than the beak. If a bird does try to bite, you may want to blow into its nostrils. This may cause the bird to release its grip, but generally it's best to simply let go of the bird and try again. You may also want to try diverting the bird's attention by sticking the end of a pencil near the bird. They'll focus on the pencil instead of your fingers. There are different ways to handle and restrain birds, depending on the size of the bird. Small birds may be maneuvered into a corner of the cage and approached from behind. Then you can grasp them at the head with your thumb and forefinger, or you can grasp them at the nape of the neck. This allows the rest of your hand to restrain the wings. Be sure not to restrict the bird's sternal movement by restraining too firmly. It's important that the bird's abdomen is held loosely to allow the chest to expand. This is probably the safest and most common way to restrain a small bird. Large birds are captured the same way as small birds, except a towel is a must to protect your hands. Sometimes even wearing heavy gloves isn't enough to protect against the bite of some larger birds, so it's crucial to divert the larger bird's attention when taking it out of the cage. When removing a large bird, grasp the head from behind at the nape of the neck with a toweled hand. Gloves may be helpful, but are often too cumbersome to get the proper grip. You'll want to use your other hand to grasp the wings and body snugly, but not too firmly to prevent the bird from escaping. Be sure your thumb and forefinger are placed close to the mandible on either side of the head, so the bird has no mobility to grab your fingers. Grasping the face could cause injury to the bird. The restraint of small mammals depends on the species you'll be handling. If rabbits are calm and don't struggle too much, you can often carry them like a puppy or kitten. Just place your hand around the rear and nestle the head between your elbow and body. Although it's uncommon, rabbits can bite, as well as scratch with their hind feet. You'll need to grasp the rabbit by the loose skin on the back of the neck and support the hindquarters with your other hand to prevent damage to the back if the rabbit kicks out. Never carry a rabbit by the ears. For some medical procedures, you can wrap a rabbit in a towel or place it in a cat bag, allowing you to expose an ear or leg for treatment. When placing a rabbit back in the cage, place the rear end down first. Guinea pigs are also usually tame enough to handle without gloves, but sometimes you may need a towel for the occasional guinea pig that fights or tries to bite. You can pick up guinea pigs just like you would a rabbit. Grasp it behind the neck and around the shoulders, then lift it while your other hand supports the hind legs. For some treatments, you can also wrap a guinea pig in a small towel. Mice are more difficult to handle since they may try to jump or bite if they're held by someone other than their owner. You should grasp the mouse as close to the base of the tail as possible. If the mouse starts to crawl away, grab the loose skin behind the neck with your thumb and forefinger before the mouse has a chance to turn around and bite. The tail and rear legs can be restrained by the remaining fingers. It's easier to grasp the mouse if it has a rough surface to grasp, or a cage top for its toes to grip while it's being taken from the cage. Hamsters are easily frightened and may become aggressive, especially when they are first awakened. In these cases, although it may be awkward, you may need to use a glove to protect your hand. Hamsters can be restrained by grasping the scruff of the neck over the shoulders. Because hamsters have excessive skin, you must completely gather in the excess skin to immobilize the hamster. Many of the fears and aggressive displays of adult dogs and cats in veterinary clinics can be prevented, reduced, or even eliminated if proper methods are used by the veterinary staff and pet owner during the first few visits when the pets are puppies and kittens. Most puppies and kittens are extremely sociable and impressionable during the first 3 to 4 months. So by taking a few minutes of time and effort, it may be possible to win over some puppies, kittens, and owners for life. You can reduce and maybe eliminate fearful behavior in puppies and kittens with calm, reassuring handling. You can start by being as friendly as possible toward the owner and new puppy or kitten when they enter the clinic. Allow tentative puppies and kittens to approach on their own, and when they do, give plenty of verbal encouragement and affection. Ignore nervous animals until they relax and advise the owner to show no apprehension or nervousness that may enhance the pet's fear. When the puppy or kitten enters the examining room, it might be best to ignore it and allow it to investigate the room while the veterinarian and owner talk. The handler should encourage the pet to approach with praise and affection, and perhaps even small food rewards. Restraint should be gentle and as minimal as is practical. Constant positive reinforcement should be used, and small-bore 25-gauge needles with subcutaneous vaccines may minimize the puppy or kitten's reaction. Difficult, pushy, or domineering puppies should be handled firmly and confidently. Never release the puppy if it's struggling, only when it calms down and submits to you. Not only is safe and proper handling important, but also the monitoring of a patient's behavior while in the clinic. Changes in behavior, obvious or subtle, are an important indication of whether a hospitalized pet's condition is improving or deteriorating. As we mentioned earlier, the pet's behavior should be recorded at the time of admission. Any change should be reported to the veterinarian throughout the course of hospitalization. Drinking, urination, defecation, and feeding habits need to be monitored closely, as well as difficulty or discomfort observed when walking dogs. The pet's activity level also needs to be watched, since weakness or depression could be an indicator that the pet's condition is deteriorating. Any minor changes in the pet's facial expression may also be significant and should be noted. It's also extremely important to assess the pet for any symptoms of increasing stress or anxiety, which could have a detrimental effect on the pet's behavior. When an animal is discharged, the veterinarian will discuss the case with the client. However, as the handler, you will be transporting the pet back to its owner. The method of carrying will depend on the medical procedure that was performed. In general, cats should be carried to the owner in a carrier, and dogs on a secure leash. This tape has provided you with the essentials in handling and restraining dogs, cats, birds, and other small mammals in the veterinary clinic. It is important to carry out these techniques to their fullest, to use common sense, and to consult with a veterinarian if you feel uncomfortable when using a certain technique or restraint method. Consult your booklet, which highlights this material, and when used with the tape, provides you with an educational reference that can be used over and over. Once you've read the booklet and reviewed the tape, take the self-test and assess your skills in the procedure